Hello, today we're going to talk about the use of face masks and helping to prevent the spread of COVID-19. Now, COVID-19 or coronavirus is a very infectious, very contagious, and potentially very deadly virus. It's affected people all over the world, our country, our state, and our counties. There is no known cure or vaccine at this time, so the only tools we have to fight this disease are preventing the disease. And that includes the 6 feet physical distancing, the use of hand sanitizer, or washing your hands with soap and water for at least 20 seconds, and also the use of face masks or cloth coverings of the face, covering your nose, your mouth, and your chin. The virus is spread by respiratory droplets, secretion. So we'll be talking, and small droplets from our mouth or nose can be spread by talking, by coughing, by breathing heavily. So by wearing a face mask, you help prevent the droplet from spreading out from my mouth to you by wearing a mask. And also when you're wearing a mask, any droplets that break through me can be prevented from reaching you by you wearing your mask as well. So it protects you from somebody who might be sick with COVID and not know they have it, what we call asymptomatic, and also gives me some protection from somebody who might have it as well. Now, I hear from some people question, wearing a mask, isn't that dangerous that you might retain carbon dioxide? That's a myth. Surgeons and operating room staff wear surgical masks for hours at a time. They're absolutely fine. So that's absolutely a myth. Another question I get sometimes is, did the CDC say don't use face masks in public? They did say that way back in March. That was before they had enough evidence to show that it does work. So face masks or cloth coverings have been proven to actually be very effective to help prevent coronavirus spread. Again, it's effective if I'm wearing a mask and you're wearing a mask. It's even more effective if we both wear masks and we're at least 6 feet apart. Concerns that I hear from people are, it's tight against my skin. I can't breathe with the mask on. It fogs up my glasses. You're absolutely right. They are uncomfortable sometimes for a lot of people. But this is a trade-off we have to really get used to. Until we get a cure or a vaccine, this has to become part of our new normal. Because coronavirus does not care, if you're a male or female, if you're old or young, what political affiliation you have. Coronavirus will infect anybody, but it may get some more sick than others. Even if we don't get sick, very ill with it, there's a chance that one of our neighbors, our relatives, our family members can become very ill with it. We've had adults die, we've had children die across the country. So nobody's immune to getting sick with coronavirus. So we have to do our best to help prevent the spread of this virus. Let's wear a mask when out in public. Let's do the whole social distancing, 6 feet. And if you walk into a business and they require a face mask, or they have a sign out there saying face mask, please wear a face mask. Because besides the medical benefits of wearing a face mask, by wearing a face mask and keeping the COVID rates low or down, it's going to help keep our economy open, our schools open when they start up again, our places of worship open, and it'll help us lead a more normal life again. COVID's rocked our whole life, but by doing what we can do to help prevent the spread of it, such as wearing a mask and doing the physical distancing, we can at least get some of that normalcy back. So please, wear your mask. Mask up, COVID down.
Masks up to keep COVID down.
Mask up to keep COVID down.
Hey everybody, happy 4th of July from beautiful Torch Lake. Stay safe out there. Don't forget, mask up, COVID down. Peace.
Mask up to keep COVID down.
Torch Lake, mask up to keep COVID down. Woo!
Mask up to keep COVID down.